Hi, I'm Dr. David Fieno. I am an invasive surgical cardiologist at Heart South Cardiovascular, Alabaster, Alabama. Today is July 28th, 2022, and we are talking about Peripheral Arterial Disease, or PAD, sometimes abbreviated PVD, Peripheral Vascular Disease. PAD is an extremely common thing, and it's very near and dear to my practice, and we have a huge emphasis on that amongst the 12 cardiologists and 100 or so employees at Heart South Cardiovascular. So I'm looking forward to today very much. One can define peripheral arterial disease as any blockage in the arteries that go anywhere but to the heart. So about 25 years ago, cardiologists started literally branching out, and instead of just looking at the heart and its arteries, cardiologists started looking at the arteries of other organs. What we found was that because of the skill needed to negotiate the arteries of the heart, that this was a very familiar territory for people who wanted to start taking care of other organs. And the ones that really got the whole thing started were the renal arteries, the ones that go to the kidneys, the arteries going to the brain, the carotid, subclavian, vertebral arteries, and then the arteries going to the legs. Now there are others, mesenteric arteries and thyroid arteries and all kinds of stuff. But at the end of the day, I think a lot of people really wanted to see a one-stop shop and have their vascular specialist able to take care of whatever blockage they might have. Peripheral arterial disease awareness started becoming more when the amputation business, spearheaded by my surgical colleagues in general surgery and vascular surgery and orthopedic surgery, started evaluating patients in terms of their heart health before a scheduled amputation. So if somebody has a non-healing wound, they would go ahead and ask for a cardiac consultation and try to make sure their heart would get through the amputation. Well, it was at this time many cardiologists realized that the artery going to that leg or that arm or that extremity was diseased, and it was so diseased that it may even be that the stump where the amputation was done would not heal properly. So what we had was a situation where cardiologist and surgeon started to overlap, and today, here it is maybe 15, 20 years later, there's a tremendous synergy between vascular surgery and cardiology in what are called limb salvage programs, or CLI, chronic limb ischemia programs. And the concept here is threefold. Is number one, can we identify PAD? Can we identify peripheral vascular disease at an early stage and hopefully prevent those blockages from ever becoming severe? That's a preventive cardiologist job. This is what I do every day in clinic. The second thing is, when we have a blockage, can we act on it early, and can we identify the best pathway? Whether it's a stent, bypass, medications, we couple into that any type of vein disease that the patients may have. Can we do things to reduce their progression of disease, like stopping smoking, lowering their cholesterol, treating their diabetes, having them lose weight, having them start walking? All these things are critical. And then the final facet of this is, when amputation is imminent, can we prepare the patient in such a way that the stump will heal, and furthermore, the patient will have the lowest likelihood of needing further amputation, or God forbid, amputation to the contralateral or other side leg or arm or what have you. One of the basic teachings of peripheral arterial disease is that once you find a blockage in one artery, the heart, for example, where cardiologists usually start, there are almost blockages in all the other arteries by definition, and there are different ways to find these. I think that PAD is tremendously underdiagnosed in our community, particularly here in Alabaster and Shelton County in the middle and northern Alabama regions, probably the whole Southwest. Certainly in California, where I trained, it was underdiagnosed. In Chicago also. The bigger thing is, how can we bring that message to the patients at a time that we can ultimately help them to have a good quality of life and avoid things like amputation and non-healing wounds and so on and so forth. So that's my overview of PAD.
Okay, that was really informative. Thank you. So let's talk more about the signs and symptoms of a patient that might be struggling with PAD and just doesn't know it.
Sure. So the question is, what are the signs and symptoms of PAD, and how can we as patients become proactive and go get evaluated when we have a problem? Well, the signs are variable. The most common symptom of PAD, and we'll just focus on the legs for a moment, is what we call claudication. Claudication is when we walk along the street or wherever and our legs start to hurt. And specifically, we stop walking and we rest, and the pain tends to get better. And as we walk less and less and the pain becomes more and more, that is more and more severe claudication. Second symptom is a non-healing wound, particularly a certain variety of non-healing wounds. The patients tend to have hairless legs. They tend to have whitening of the skin, and rather than brown, dark colored legs, which is what we see in vein disease, we see this slight lightening of the skin and wounds that won't heal well, even with proper wound care. The last thing is a finding that's a little subtle, but if you start looking for it, you'll see it. You'll see that some patients just simply stop doing stuff. They stop walking to the mailbox, they need a wheelchair, they use the hover around at Walmart or Disney instead of walking like we all should. And you ask them why, and they'll attribute it to arthritis. They'll say, you know, my joints hurt too badly, doc, I don't feel good. And you find out that these folks actually have peripheral arterial disease. The people that are at highest risk for this are people with diabetes, high cholesterol, blockages in other parts of their body, such as the heart, anybody who smokes, and definitely people with a family history. The way in which this is diagnosed is relatively simple. Start with your primary care doctor. They can either get the testing going, sometimes they can do it in their office, or they can get you to a vascular specialist. We do ultrasound testing, we do ankle brachial index testing, CT scans, MRI scans, and formal angiograms. And all of these, in increasing order, are more and more accurate for getting at this question of, does somebody have blockages in the arteries of the legs? Now, just going on to the rest of the body for a moment, the process is very similar with other areas of the body. So kidney artery blockages, carotid artery blockages, things like that. And the biggest thing is you have to have that relationship with a vascular specialist who knows once we've diagnosed it in one organ bed, it's probably appropriate to check everything else at some point.
I've heard that restless leg syndrome is also a symptom that's with PAD. Can you talk a little bit more about that?
Absolutely. So RLS, or restless leg syndrome, is kind of a catch-all phrase, and the question is RLS related to peripheral vascular disease? Traditionally, restless leg syndrome was thought to be a nervous system disorder, that people suffering with certain tremors, anxiety, would have leg pain and shaking and unexpected involuntary twitches at night, especially when they went to bed. And if you talk to people about RLS for any length of time, you find out it really does affect a large number of the population. Well, as time went on, we realized that probably a lot of what we were labeling RLS was really what we call vascular insufficiency. So we mentioned PAD at the beginning of this talk. That refers to blockages of the arteries. Well, in a similar way, the veins of the legs and other parts of the body can become dysfunctional. And when either the blockages of the arteries going to the legs and or the veins of the legs are sufficiently dysfunctional that blood flow is insufficient for whatever reason, that can create a whole medley, I should say, of symptoms. And I mentioned claudication as one. What we call neuropathic pain or neuropathy. This can be pins and needles tingling of the legs. A lot of people get paresthesias, and paresthesias refer to that whole pins and needles tingling that people will have. And the difference is it won't be when they slept on it or were sitting in a chair for too long. It'll just happen out of nowhere when they're walking. And increasingly, we're becoming aware that these symptoms that were originally attributed to neurologic problems and were the neurologist's domain, including restless leg syndrome, probably on some level, maybe 50% of these are manifestations of vascular insufficiency, either on the artery side and or on the vein side. Of course, what I tell people is the test of this is if we look at your arteries and veins, if we find a problem, if we decide that that's the culprit, as we call it, we do something to repair, replace, fix, ablate, whatever, those culprit vessels, and then we reevaluate you. If the signs and symptoms of restless leg syndrome go away, then we were right. And honestly, at the end of the day, that's the only real test that we have to confirm or refute whether we were correct.
I see. So what type of patient will you see with this? Are you going to see someone who's 30 years old with PAD, PVD, or are we expecting to see this more commonly seen in older patients?
So peripheral arterial disease is a disease that is more prevalent, is more common as we get older. It's not impossible to have blockages to the arteries of the legs or other parts of the body in our 20s and 30s, but it's not as common as when we get into our 40s, 50s, 60s, and above. I think patients with a strong family history are definitely screened more aggressively. I think patients with a lot of risk factors, smoking, high cholesterol, diabetes, especially uncontrolled diabetes, hypertension, they definitely warrant a vascular screening. I think patients who have symptoms that we mentioned, leg pain, unexplained neuropathy, certainly things like discoloration. And the one that really causes a cardiologist's eyebrows to go up is when somebody has a non-healing wound, especially one to the leg. And we are seeing more and more of these as the very first presentation of PAD. They come in fact, we had a free vein screening at the Heart South Vein Center here on the first floor about a week ago, and a man came in and had an actual black toe, and it was obviously gangrenous, and that was the first sign that we had in that patient that they had an occluded artery, and we were able to get that taken care of for him, so he can hopefully avoid any more of those things. So obviously, if you're having symptoms, definitely get evaluated. The other side of that equation is if you're worried about it, or if you feel like you should be worried about it, go and get a consultation and get seen by somebody who sees this stuff day in and day out, like we do at Heart South, and there are a number of excellent centers here in the Birmingham area, and get that evaluation so you can be informed what your situation is.
So I get a consult. Then what? What happens next?
So typically in a cardiology practice, very often you'll get an evaluation of your total medical situation. Now, I can't speak for other practices, but I can speak for Heart South. So that'll include all your meds that you take for everything, your allergies, your social history, types of surgeries you've had, and then a thorough description of what you're feeling and what your concerns are. That'll be followed by an in-depth physical exam. My vascular specialists at my practice, I'm very proud of them because all their patients come out usually barefooted, and they put their shoes on in the hallway because they almost all have to take their socks and shoes off, and they'll actually palpate for the pulses in the feet and the legs. And I have to say, not every vascular specialist does that, but the folks who are interested in PAD, they really, honest to God, do on every one of their patients. Then what will happen is a series of tests will be ordered. We mentioned ankle brachial index, that's a blood pressure test. Ultrasounds, including Doppler ultrasound, which can tell stenosis severity in certain arteries. CT scans, and possibly even what we call formal angiogram. An angiogram, which is also called an arteriogram here in Alabama, same thing. We go in with a small tube and we actually take pictures with dye, so it's a little invasive. When we do that, we can then pivot, and if we have a blockage, in principle, we can fix it right there and then on the spot. This is something that is a gold standard test for PVD, so it's always correct. It just comes at the risk of the actual procedure itself, which is minimal, but not zero. And then the other side of this is the importance of medical therapy and risk factor reduction. So a patient can probably expect to be put on aspirin. If you end up having severe blockages, you can expect to be put on several medications, cholesterol lowering medications, diabetes medications, blood pressure lowering medications, and then you'll also expect to be put on an exercise and diet program in order to reduce your risk of things moving forward. The last part of this is accountability and continuity. Patients need to be seen a couple times a year, a couple times a quarter sometimes, in order to determine whether or not their disease is progressing, whether it's getting better, and then how we should change treatment plan at that time. The final thing, especially in my practice, I'm very proud of the communication that happens with the staff. We have a wonderful group of phone nurses and other staff who try to stay in touch with the patient, find out how they're doing, and certainly if they're having trouble, have them come back and seen sooner so that we can take care of that and get them feeling better.
You mentioned free vein screenings that we do at Heart South. Talk a little bit more about that. How long does that take? Is it really free? Is there a catch to it? Let us know more about that.
So it's a great question. So the question is, what are free vein screenings? Are they really free? And what exactly do we do at Heart South? So Heart South is a 12 cardiologist group in the heart of Alabaster, Alabama, and we have a huge emphasis on peripheral vascular disease, leg arteries, leg veins, pain, non-healing wounds, and we have a very strong contingent of doctors who know all the most modern techniques for dealing with, diagnosing, and taking care of these problems. About 7-8 years ago, one of the staff members figured out that we can offer a free initial screening for artery and vein disease. And about once a month, often on a Monday, we will, in the afternoon, bring in a series of patients who have either been referred or have self-referred, have called the office. And we will see them right here in the clinic. They will get an ultrasound, they will get an ankle brachial index, and the ultrasound will give them an idea of if they have vein disease. The ABI, or ankle brachial index, will give us an idea if they have artery disease. And they'll actually be seen by a clinician who will make a recommendation about whether or not they need further testing. Now, there's no requirement for the free vein screening. I see a lot of uninsured patients, and we try to do everything we can for everybody that we see. But the big thing is that if we can identify the problem relatively early, hopefully we can get a patient in with the care that they need. To say the least, we found a lot of previously undiagnosed disease in these free vein screenings. And we see between 10 and 40 patients in a time span of about an hour to an hour and a half. And it really is a fun way to get involved in the community. We've done it here at the 1022 building. We've done it down in Clanton before. We've done it at several other places. And I've really found that bringing the message to the customer, as the expression goes, really gives a certain ease with which people are able to get seen, because I think when they're not yet on the hook, when they haven't yet decided they're making the appointment, there's a certain amount of comfort they have with just finding out what the images show and talking to somebody about it.
So how do I get a free vein screening? Do I have to call you? Do I have to come show up? Is
So
it on your
there's
website?
there's a couple of different ways. Yes, yes, and yes.
Perfect.
So the question is, how do you actually get a free vein screening? You can call Heart South personally at 205-663-5775. and we'll set you up in our next available screening. You can have your primary doctor give the office a call and just say free vein screening for Mr. Smith. You can have your vascular specialist, who maybe doesn't do a lot of vein work or a lot of leg artery work, sign you up for a free vein screening. And you can also log into our website, www.heartsouthpc.com, and we can try to fit you in and try to get you in with the specialist that you need to see.
Great. Thank you so much, Dr. Fieno. Anything else you want to add before we close this one out?
It's my pleasure. The importance of leg arteries and what we call peripheral arterial disease is hard to overstate. I think folks have a lot of worry out there. There's no need to necessarily be worried about it. Get evaluated. There's lots we can do. There's lots of patients who we have helped a lot. Early detection is key. If you've got a question, come and see us.